Hey, what's going on? Charles Austin here, and let's be fit forever. All right, so it's been a little while since I've streamed. I'm back, and I'll be back every Monday, Wednesday at 6 p.m. Central Time, and be back also on Saturdays at 1 p.m. Central Time as well. But today I wanted to talk to you a little bit about soft tissue injuries. All right, so this is one of those subjects where I think most people at some point have either suffered a soft tissue injury, know somebody that suffered a soft tissue injury. If you follow sports, I'm sure you've seen dozens and dozens and dozens of soft tissue injuries. If your child plays sports, if you still play sports, or if you're active, at some point you've been affected by a soft tissue injury. So, what I want to do is kind of just talk about what those things are and how to treat them. Because one of the biggest no nos well, we'll get into that in just a second, all right? But again, before we dive in, let's please make sure you're always hitting that like button below and subscribe to the channel so that you're always up to date with the latest content here on my page. Again, so remember, we're going to be streaming Mondays and Wednesdays at 6 p.m. Central Time, and then also every Saturday at 1 p.m. Central Time as well. But let's go ahead and dive right in like I always like to do. And let's just kind of first talk about what exactly a soft tissue injury is, right? So, as we see right up here, what before we talk about soft tissue injuries, we need to make sure we know what soft tissue is. So, as it says up here, soft tissue is basically body tissue that is not hardened or calcified. So, what that means is we're not talking bone for the most part, okay? So, examples include things like tendons, all right? They include muscle. Also, you can include skin and fat. But what is not mentioned here as well is also ligaments and cartilage. Okay, so those are all examples of soft tissue. We won't really talk too much about skin and fat or anything like that, but we will, talk about tendons and muscles and ligaments because those are common injuries that happen to athletes, happen to regular folk like you and I who are regularly active, right? So um, some of you might be wondering, well, what the heck is a tendon, right? I'm not exactly sure what is a ligament. So let's kind of break those down real quick. So if we talk about, let's start with ligaments, for example, right? So what I did here is I pulled up the knee, and if you're looking right here, we've pulled up the knee. I'm going to go ahead and zoom in on that a little bit. There we go. Yeah. So what we're looking at here is the knee, right? And right here is your anterior cruciate ligament, aka ACL, right? So if you follow any sport, right, for my footballers, basketballers, soccer, whatever, baseball, whatever, at some point, some teams, a player on some team, somebody you follow, or a team or whatever, somebody has suffered unfortunately an ACL injury again. Okay, so again, your ACL is an example of a ligament, and ligaments basically connect bone to bone. All right, so in this example, this ACL is connecting your thigh bone, which you see femur bone is technical term, and it connects to your lower leg down here, which is your tibia. Okay, so that's what ligaments are, right? So zoom back out there. So what are tendons, right? Again, we talked about tendons as one of those as well, right? So tendons basically connect muscle to bone, all right? And as we look right here, a good example is your Achilles tendon, okay? And so basically it attaches around your lower leg, your calf muscle, if you will, right? And that's what you see right here. Gastrocnemius is basically the technical scientific term for calf muscle. And it attaches down into your heel bone or your calcaneus that you see right here, right? So again, we have tendons all over our bodies, but this is a very common one that if you literally just felt down towards the back of your lower leg towards your foot, you can feel that. It's a thick piece of tissue, right? So that's an example of a tendon, right? Um, And cartilage, we talked about cartilage is another type of soft tissue. So a good example here is your menisci, and that's the plural form. And I'm trying to zoom in here, yeah. And that's the plural form for meniscus, right? So we have a meniscus on both our medial and lateral side. That just basically means inside and out, okay? And basically, this is a type of tissue, specifically in your knee, that helps cushion your knee. So your femur bone sits on top of your tibia, and it's basically there. This cartilage here is basically there to help cushion that area. Okay, so that's an example of cartilage. We won't talk about that one too much today, but very briefly. And last but not least, everybody kind of knows what muscles are. We know they help us move, and they help us stabilize joints and support our bodies. So I pulled up an example. If we're curious about about muscles, hamstrings is an example that I pulled up right there. Okay, so see if I can get back where I was here. There we go. All right, so that's kind of an idea again about what soft tissue is, and I gave you some examples. Okay, so let's talk about what exactly a tissue injury is. All right, what is a soft tissue injury? Okay, so basically, examples of soft tissue injuries include things like contusions. If you bang your leg on the table or chair, right? That's a bruise. Sprains, we'll talk about in detail. Tendonitis is an example. Bursitis, that's basically inflammation in fluid-filled sacs that help cushion joints as well. But also strains. So primarily, real quick, as we go through today, we'll talk about strains, and we'll talk about sprains, and very briefly, tendonitis, right? So real quick, let's talk about let's kind of define sprain, all right? I think everybody said, oh, I sprained this, I sprained my elbow, or I sprained my wrist, I sprained my back, I sprained my ankle, whatever, right? Let's talk about those. And I wanted to start with ankle sprain. Okay. Well, before we get to ankle sprain, let's define what a sprain is, right? So basically, if you talk about a sprain, and it's SP, as you can see, and that's gonna become important when we go to strains, right? But sprain, SP. Okay. This is basically a stretching or a tearing of ligaments. Okay. So if I go back to the image here, you have certain ligaments that are that stabilize your ankle joint. Okay, there's a few different ones here. All right, and basically, if you ever heard somebody say, or even you say, "Oh, I twisted my ankle, I rolled my ankle." Basically, what's happening is these ligaments here that are connecting bone, they've been stretched too far. I wish I had my rubber band. I normally have a rubber band when I do this, but they've been stretched too far, or there may be some small tears in that ligament. And that's all we're talking about when we're talking about I rolled my ankle or I sprained my wrist, right? So one of the key things to remember about sprains is that they're specific when we're talking about ligaments. Okay, and again, if you want to remember what a ligament is, remember they connect bone and bone. Okay, so that's basically what a sprain is. All right, and I think ankle sprain, I think most of us have sprained their ankle before. Okay, so what about strains? All right, so we said sprain is SP. Well, what about strains? Okay, well, strains deal with muscles, and they also deal with tendons. Okay, remember tendons connect muscle and bone. So when we're talking about strains, ST, we're really talking about injuries to muscles and tendons. So again, these are where you're, again, very similar, again, overstretch. There may be tears in the tendon or the muscle, and that's what we're talking about. We're talking about strains. Sometimes we call them pulled muscle, right? Oh, I pulled my hamstring, right? I pulled my quad. Those are examples of muscular injuries, right? When we're talking about strains, okay? And then also, like I said, I wanted to make sure I briefly mentioned tendonitis. And if y'all are just joining, we are talking about soft tissue injuries. We've already kind of talked about what soft tissue is, and we're kind of going over some of those different types of injuries. Now, different from if we're talking about sprains and strains, you know, how do we get these injuries, right? You might be playing basketball and maybe you landed on somebody's foot wrong and your ankle rolls, right? Or, you know, if you're talking about a muscle strain, and this actually happened to me about a month ago. I was moving a mattress and I was rushing, and I know better. I've been squatting my whole life, and for whatever reason, I rushed and I strained my back. Okay, so there are so many different ways you can do it. Just doing things around the house. You might trip on the stairs. Again, you might be exercising, playing a sport, whatever. There's so many different ways that we can get these injuries. So when we're talking about sprains and strains, we're talking about, oops, how did that happen, right? Well, tendonitis is a little bit different. This is more of I don't even like to necessarily call it an injury. It's kind of something you deal with because basically over time you've continued to do a continuous motion, right? So if we define tendonitis is inflammation or irritation of a tendon, right? So again, the way this happens is over time, and you see up here tennis elbow, right? The reason why they call it tennis elbow is because the constant swing of that racket, and over time, you just cause damage and you wear that area down, right? Jumper's knee, right? Well, that's just tendonitis from somebody who has been jumping too much, right? Maybe a basketballer, maybe a gymnast, right? Pitcher's shoulder, okay? Again, that constant motion of throwing that pitch over and over again can do some wear and tear to your shoulder. So again, these aren't necessarily injuries that kind of just happen, but they do take place over time, and over time you can build up. So I think probably most of us are going to have certain varying degrees of tendonitis. We're going to have a little bit just because over time joints kind of wear. Okay, so it's quite normal to have tendonitis. It just depends on the severity, right? Some people have it worse than others. Now let's get back to the main two, like I wanted to talk to: soft tissue injuries, strains, and sprains. That's the main focus of today, right? So, what do these things feel like, right? So, if you notice that you've had a sprain or a strain, you know, obviously you're going to see things like pain. You're going to feel things like pain. It's going to hurt, right? And again, this depends on the severity of the injury, right? So you're going to feel pain. Depending on the severity, you're going to have swelling. There may be some bruising or discoloration. There may be some limited ability to move that joint. And even when the injury happens, you might even hear or feel a pop, and it might scare you a little bit. And if we go through strains, a lot of the same symptoms, right? Pain, there may be bruising, motion, limited motion in that area, swelling, etc., right? So those are all symptoms of a muscle strain or sprain, okay? So why the heck am I talking so much about muscle strains, muscle sprains, these type of injuries, right? Well, the main reason is throughout my career, whether I've worked with athletes, whether I've worked with common folk like you and I, somebody just saying, hey, I just want to get in better shape, I want to lose weight or whatever. Over those years, people tend to get injured. You know, it happens. Working out too hard. Oops, you know, I twisted this, I did this. Injuries happen. And it never fails. The first thing that, you know, it doesn't matter if it's an athlete, an adult athlete, a child athlete, doesn't matter if it's adult client, child client, whatever. The first question I always get is, how do I stretch this out? How do I work this out? And the question just bothers me always, because the answer to that question is you can't, you don't, you shouldn't. Okay, you shouldn't work it out, you shouldn't stretch it out. So what I want to really, and it's going to sound so simple, and it's so difficult for folks like me, and if you're like me, I love to be in motion, I love to move, love to train, right? And when you get injured, you hate doing this type of treatment. But I wanted to make sure I went over the type of treatment that you need to have, the type of treatment you need to take care of um, when you are injured, right? So now this site is a little busy, but boy, it's almost like I wrote this site myself for the most part because it really gets straight to the point, and I love it, right? So one of the things, the first thing is, as you see, mild strain. We said already that depending on the severity, um, different strains and sprains will feel differently, right? Um, so different strains and sprains will feel differently. Somebody's asking for the link to this video, which I'm happily to oblige. Give me a second, y'all. Let me pull this up. I can't lose a second here. If somebody's asking for a link, I am going to provide it. Give me 1 second here, y'all. There we go. Copied the link, and I'm gonna send it on over. Okay. So sorry about that. So again, we're talking about different degrees of strains, right? So again, if it's a if we're talking about a mild strain, right? Um, this is you're gonna feel a certain amount of injury, a certain amount of pain, a certain amount of swelling, right? If it's a little bit more moderate, right? This could be partial tear, moderate pain, tenderness, etc., right? And sometimes you could have a complete rupture of that muscle or tendon or ligament. So there are different degrees of injuries, right? So um, again, let's get back to the video. This page here that I really like the way they explain how you treat it. So generally, if you have a strain or a sprain, you should be able to return to normal activities within 3 to 6 weeks, right? Give or take. And how do we get to this point? Basic home care. All right. Now again, keep in mind that I am not a doctor. I'm not a surgeon. I'm not an orthopedic surgeon. So I'm not giving you medical advice. But generally, if you take care of yourself at home, within a few weeks, you should be fine. All right. Now, as it says here, as the strains become a little bit more severe, recovery can take several months. And this is where patience comes in. All right. A lot of folks, and I'm one of them, I'm guilty as charged, right? A lot of folks don't want to wait so long for these injuries to heal. But the only way for you to get back to being 100% is to allow those injuries to heal. Okay. And again, as it says here, in severe cases, if you have a complete rupture or a severe tear, you may need surgery. Most of the time, most of us, on average, you're talking weeks to a month of allowing that injury to properly heal, depending on the person, depending on the severity. All right. So again, what are we talking about when we're talking home care? What do you mean, Charles? What do you mean with home care? So this is literally the easiest thing to remember, right? And you've probably heard it at some point. I always remembered it when I was studying this in college. They taught us just to say rice. Say it over and over again, rice. Well, the first thing you have to do is rest. And this is the most difficult thing for people to do, especially athletes, especially people who love to train. It's so difficult to say, oh, I can't do anything and rest. And like I said, recently I hurt my own back. And there were days where I literally just had to stay on the couch and just sit there. Because I knew that in order for me to get back to what I wanted to be, I had to rest. Okay? So generally the first couple of days, you're really going to want to rest and don't do anything. If it's a sprained ankle, don't put any weight on that ankle, right? If it's a strained back, you want to limit the amount of activity your back has. Whatever that injury is, wherever it is on your body, limit the activity, little to none, okay? The next thing on here says ice. Generally, this is going to be within the first 2 to 3 days, okay? Where you're going to be icing it. And here it says each hour. Not necessarily. depending on the person and their tolerance. But generally, you want to ice for 20-25 minutes every few hours. Okay, or as much as you can. If you have to work, you try to fit it in when you can, right? But you're going to want to ice, and we're doing this because we want to reduce inflammation and swelling, right? And it also helps with pain. Also, compression. So on this article here, you can see like we have a bandage here. These are great. You can pick them up at any local store or drugstore, right? And these are great for wrapping mild and moderate injuries, all right? So they're good for compression and support. So the reason why we want to do compression and support, wraps, braces, is because we want to try to stabilize that joint as much as possible. We don't want a lot of motion. Okay, so in order for that particular injury to heal, we gotta have stabilization. We also want to have compression, which helps with the swelling. And if you can, you want to elevate it, and this basically also helps with swelling as well. Now, medication, that's going to be on a case-by-case basis, depending on the person. Personally, you can use different techniques. You can use different anti-inflammatory medications. Things like CBG is a cannabinoid, which is great for joint and muscle relaxation. So these are good things as well. So heat is also involved eventually, not necessarily in the first couple days, but as you're continuing to nurse that injury, right? What you want to do is kind of try to work with alternating therapy, right? So maybe you're icing it for 25 minutes, and then you heat it up, heating pad for 25 minutes, and then you take a break. And then you repeat that cycle throughout your day, every few hours. So you're getting the best of both worlds. Ice is good for reducing inflammation and pain. Heat is good for relaxing the area and promoting circulation, okay? So keep in mind, you don't want to keep the swelling down too much, because remember, the reason why these injuries swell is because your body is sending so much blood and nutrition to that area in order to heal it. So you don't want to necessarily take the swelling down to a non-existent level, but you don't want it to get too much either, because you could have circulation issues. So it's got to be prepared for that. So again, here's the question everybody always asks: how do you stretch it? How do you stretch it? What kind of stretches can I do? Well, don't stretch. Like I said, I think I wrote this article myself. All right, but do not stretch. Don't stretch it. Don't move it. Don't do any of those things. Right? If you know that you have a soft tissue injury, okay, stretching actually causes more damage, right? So as you see right here, does stretching cause microscopic muscle tears, right? So this doesn't necessarily always apply just to injuries, right? Even if you're just a normal healthy person and you stretch, the same thing happens, right? So as it says here, stretching can cause microscopic tears in muscles, tendons, and other surrounding tissue, right? These small tears, as you stretch, they naturally heal themselves as long as you rest the muscle for the next couple days. So again, you got to keep in mind that if you already have damage to your ligament, tendon, or muscle, and then you say, well, let me try to stretch this ligament, tendon, or muscle that's already damaged, you may have an issue with making that injury worse. Okay, so you don't want to do that. So again, keep in mind that stretching actually causes tears in your muscle, which is normal, but you don't want, that's fine for healthy muscles and joints, right? But you don't want to do that to an area that's already injured. So again, we want to make sure we're resting it, we're icing it, we're compressing it, and we're elevating it. Remember, you can remember this with rice, okay? So last little bit here about rehab, right? So once you finally say, hey, I've rested, I'm starting to feel better, I'm starting to feel stronger, the pain is gone, the swelling's gone, I'm feeling pretty good. And again, depending on severity, this could take, 3 weeks, 4 weeks, a month, 6 weeks, whatever it is. But what you'll start doing is different exercises, right? I didn't mean to bring up the dog there. But basically, what you'll want to do is start increasing your range of motion, right? So this is not day one of your injury, all right? This is after you have healed. So you don't want to jump back in and go full speed. So you want to start doing things like increasing your range of motion and try to move around a little bit, right? And then you'll want to keep, try to start working into the exercises you were doing before. And then, once you feel good with the exercises you're doing before, maybe you want to try to ramp it up a little bit. Okay. So then at that point, once you've healed, once everything's feeling better, now you can start getting into regular stretching and exercise routines after the fact. But the one overarching takeaway I want everybody to make sure that they understand is that if you have strained muscles, if you have sprained ligaments, don't stretch. Don't stretch. Don't stretch. Stabilize that area. Rest that area. Ice that area. And remember, take it easy. You have to heal first before you can do anything else. Okay? So awesome. That's all I got for y'all today. For today's video. Always we do a Q&A at the end, so it's a perfect time. If you have questions, pop them in the chat. Okay? And keep in mind, we'll be back here Wednesday at 6 p.m. Central Time. And we'll also be back here Saturday at 1 p.m. Central Time as well. Oh, so I got one here on Facebook. All right, so this question says, if I'm somebody who, what does it say again? I thought I had it here. If I'm somebody who regularly has issues with my hamstrings, what is something that I can do to reduce, I guess they're just trying to say, how can I avoid having those injuries? Well, basically, number one, you want to make sure you heal first. All right, I can't stress that enough. You want to make sure that the first thing that you do is you heal. Okay, that's number one. If you're noticing that you just can't quite get it right and you notice that the injury keeps reoccurring, maybe at that point you may want to consult maybe an orthopedic or maybe consult a physician to say, hey, maybe there's permanent damage, possibly, right? But if you're saying, hey, I just kind of tweak it here and there, one of the things you got to make sure you do is always get a proper warm-up. Okay, make sure you're always getting a proper warm-up, and also start working on exercises that strengthen the areas around that muscle. Okay, so even your knee and also your hamstrings as well. And then maintain your flexibility. When you're healthy, when you're 100%, stretch again, and then stretch some more. So make sure that you have a good range of motion. Okay. Let's see. I didn't know how to go between hot and cold. Don't stretch a strained muscle, but should I stretch before working out to prevent strain? So on the hot and cold, basically this is towards the middle part of your recovery, right? So let's say on day one, that's when the ankle sprain happened or the muscle strain, whatever it is, right? You're not doing hot on day one. You're not doing hot on day two. Once you maybe get around day three, you should be feeling better. Normally, that first 24 hours, when you wake up the next day, you're normally feeling pretty good or a little bit better. And then 48 hours. So maybe on 72 hours, then you can start alternating hot and cold. As far as before working out, don't stretch. No, bad idea. Studies have shown that stretching before training, stretching before athletic performance actually reduces your ability to perform, especially strength, right? So the best thing to do is just do motion, get the muscles and joints warm and lubricated, and after you're done with your activity or your exercise, then you stretch, all right, and then allow your body time to recover. But good questions on Facebook and YouTube, all right? Okay. I think we had fun. All right. So I think we're going to call it there. And again, remember, streaming every Monday, Wednesday at 6 p.m. and Saturdays at 1 p.m. Always having a Q&A at the end. You can ask about the video. You can ask about anything that has to do with health and fitness related to our human bodies that we have today. Remember, make sure you like this video, subscribe to the channel so that you're always